News a Zoom room where it's been a minute since we talked with Mary Rhodes from the Guamatone Restaurant Association. Good morning, Mary. Welcome to
Hi,
the
good
link.
morning. Thank you. Half a day.
I just
Buenas.
now that we got here, I just want to say that I know that you were one of the people when we were doing containing COVID. You shot me a message and been like, "Hey, I love this show. I'm telling everybody you guys got to keep it going." And well, here we are. So
Yes, absolutely. You guys are doing a great job.
thank
Thanks,
you.
Mary.
Nice books in the background, by the way. Those are real books, kids.
They're real.
Yeah.
They're real. They're not fake.
In case you don't know, those are things that you open and you read.
Yeah, they have words in them, and then people would use what was called a bookmark to put
Yeah.
in the book that would mark where they were in the book when they would read the book.
Yes.
God, Dad, you're so old. I just use my Kindle.
Now, my kids read books. We actually have a bookshelf with books that we read. So, 920. Mary, we wanted to bring you on GHRA, PCOR 1. I guess just first of all, what are your thoughts? Because we had touched base before the real PCOR 1 announcement, which came on Friday, that we're talking the heavy lockdown that we're now living under. And I remember you had shot a couple messages at the when they initially made the announcement, but I know they had kind of retooled what was going to be closed, what was going to be open. I mean, that being said, what's GHRA and what's their posture with this lockdown?
Well, obviously, we would have liked to have seen the governor keep it to PCOR 2 with just further limitations. The week prior, we had already seen some scale back. She scaled back certain businesses because of where the vectors were from or the clusters were coming from. And we understand those decisions, and obviously we believe they're necessary, and everybody is taking all the precautionary measures. And we are actually even working with public health. We've had meetings with them every time anybody needed clarification or guidance, to make sure that every time the guidance memos come out, we get clarification on that, and we send out that information to our members. One of the key things is really making sure all businesses, not just GHRA members, but all businesses continue to put together their plans that meet the guidance memo and implement those plans and communicate them to employees and guests, and to make sure that they have those guidelines and sanitary and safety health guidelines in place. And so we've been working with a lot of our members on that, on seeking clarification every time there have been changes, sometimes on a weekly basis, as you already know. So we would have liked to have seen it at PCOR 2 with further limitations, understanding that the governor and her team were pretty adamant about going back to PCOR 1. We did send, messages her way as well as to her team, and we are appreciative that she continued to keep the restaurants and, of course, the hotels open. But even other businesses like the manufacturers of food, wholesalers, distributors, because it's extremely important, especially during an emergency. We've seen this where it creates a frenzy and a huge, this huge crowding of people at stores. And I know that even the stores have social distancing measures, and you still have to wear a mask and sanitize before you enter. But just having masses of people in a certain area waiting to get in is not a good way to approach things. So she was very good about being open to making sure that we don't create such a frenzy, although human nature, people are still going to go out and shop the way they do. But it was really essential that we keep businesses open, especially food related, whether it's a grocery store, convenience store, obviously all the fuel stations, service stations, but especially the restaurants, because when you think about how food is distributed, not everybody goes to the grocery store and cooks food. There are a lot of families or individuals who may not have kitchens or kitchenettes or even the ability to cook because
Right.
either disabled or elderly. There's so many reasons why people patron restaurants.
Mary, I
And-
mean, way simpler than that. There's a lot of people who are working, and we get
Yep.
lunch. I mean, yeah. And I know that last week we had Crystal Pacos and Augustine on. She was like, "Oh yeah, some people don't cook." I'm like, "Yeah, well, this is Guam. Everybody cooks. It's more like people are working, and we need to be able to grab lunch to go." So yeah.
Yeah, I mean, there's a lot of different reasons why people need to access food in different ways. But the most important thing is really about food distribution and the sustenance, right? Food security. We have to remember that certain items that wholesalers, distributors sell isn't always just at the grocery stores. There are certain weights and amounts and sizes that are really only sold to larger purchasers like hotels and restaurants. And so distributors would end up having certain types of quantities or the types of food or drinks only available at certain outlets. So it's important that we keep the food distribution channel open for sustainability and food security, so that we don't have any food shortages and we're not causing any food shortages. So I think the governor and her team have been really open to that, of course, with certain concerns. But I think that with the exception of a few, there have been really good examples of businesses where restaurants and hotels have really displayed their ability to practice good hygiene, and not just good hygiene and safety, but really make sure that they stagger schedules. They have a really good contact tracing program, which is part of their plan. And they've put all the measures in place, and they've actually worked with public health if they've already been inspected to make sure that they've proven that we can reopen and we can be held accountable, and we can run a good business with protecting our employees as well as the community.
Have you guys gotten any indication about the likelihood that this lockdown is going to continue past this? Was it this Friday? This Saturday?
I think the most challenging part about the PCORs are how we move in between, right? The transitioning. That's why we really would have liked to have seen it just go to PCOR 2, so that's not 2 levels down. But looking at the numbers, I know that the governor and her team are really adamant about health and safety of the island first with its people. And so that's why PCOR 1 was necessary. And we really have to understand these numbers. We need to make sure we understand with all the contact tracing where they're coming from, so that when we do reopen, we identify those and we don't treat everybody the same. We need to allow businesses to reopen at some point. And I'm really hoping that at the end of this week, it'll be reconsidered at least to go to PCOR 2 with limitations, and then but really concentrate again on the businesses that have not had any situations take place. Mm-hmm. But I think at some point, there are a lot of people who have said this, and I think at some point, it is going to be community spread, and we have to understand that a certain amount of people will get exposed to it. So we have to practice good safety operations, in the fact that you stagger schedules, so that if in case you do have an incident, you don't have to close your business the next day just because you had a COVID question of somebody coming in contact with somebody. You need to stagger schedules so that you can remain operational, where those people who worked during that schedule might be in question. Similar to what Paradise Fitness, where they were very specific to the hours that employee worked. Businesses have really taken to heart with that. And I think that's a smart way of doing contact tracing and making sure that those other employees who did not come in contact, as long as you are cleaning the areas, sanitizing, disinfecting, especially immediately after, you can get operational again the following day if you take all the precautionary measures in advance, though, and then immediately afterwards. One of the big things that we've been working on is putting together the pandemic plan and putting it in a guidebook, because there's so many documents out there, and even the pandemic plan is made up so many folders from public health. And we're working on this guidebook together with a crisis communications plan, so people know how to communicate to their employees internally, but also to all their stakeholders, including the media, the public, the community, to all their vendors, anyone who might have come in contact. And then how do you stagger schedules and ensure that you're tracking all the hours and then the cleaning schedules, and every time you've had a question, you would sanitize, disinfect.
Wow, that's good to see you guys planning.
You know, one thing
Yeah,
that
I think it's really important for us to really prove when we go back to PCOR 3. I think the only way we're going to go to PCOR 4 is if we all work together and we can illustrate this to the governor, because obviously a vaccine is not going to come out anytime soon.
Right.
And that is what's required to get to PCOR 4. So even without the vaccine, I think that we can work together as an island to get everybody comfortable that even if you might have had contact, or let's say you have a positive case, that all the measures have taken place to reduce the exposure. And that's what's really important, is about reducing exposure and managing it.
You good? Yeah.
Well, and I don't even know if you could speak on this, but we get these reports from the Division of Environmental Health, from Public Health, and they go out and they do the sanitation inspections, but they're also doing like COVID enforcement inspections. Is that something that GHRA is reaching out to their members about? Hey, you need to make sure that you meet all of these guidelines. And I don't know if it's a separate guidelines from the COVID enforcement and the regular sanitation inspections.
Yes, actually about 4 weeks ago, we had a Zoom conference call with Public Health, with the Division of Environmental Health Services. We actually have a really good working relationship with them. Every time they've needed to communicate like the Guam Food Code changes or even something like this, they actually gave us the checklist. And I don't know if you got that email, but that's going to go into our guidebook. We have the checklist of what they're looking for during the inspection, but just mind you, they're not just looking for COVID safety guidelines, they're also looking for things on the Guam Food Code at the same time. Right. So that checklist is very important because it's very comprehensive. And Public Health didn't have an issue of releasing that, because part of our job, both Public Health and GHRA, nonprofits who work with them, is about communication, education, creating an awareness, and compliance. Compliance is the number one thing.
All right.
So they're not just an enforcement agency, they're really into compliance and education.
Right.
All right. Yeah, I was wondering, because we started getting the COVID enforcement results, maybe even like you said, a couple weeks ago. And I was trying to figure out the difference between the two. So
Right. So what are some of the things that people are getting pinged on? Bree, I saw there in the violations, there was one, wasn't social distancing or
hand washing facilities. Yeah.
Okay.
Not having a sign on the door is probably their number one, and also not having a plan.
Yeah.
So you can't assume just because there's a general guidance on a memo for restaurants or bars or even cosmetology that you fall under that. Right. You still need to have a plan. And so if you need help with that, GHRA is available. We can help you put together that plan. We have that resource. We have the checklists for every checklist that they have available for the different business sectors. We have that available. And so we hope to release the guidebook soon, and so that will be all inclusive. Of course, it's a fluid project. Right. If in case we get more checklists, then we'll definitely add more. But other than reopening and getting back to business, we're not just essential businesses are open, but just general business. We really need this for obviously our businesses, our employees of the industry to get back to work, but also our community to get to some kind of normalcy, even though it's not normal anymore. Right. We do need to reopen at some point, but we have to be comfortable and make sure that everybody understands what's required of them so that they can stay open. That's the thing, is staying open. Stay open, stay smart, stay open, right? So you have to survive in order to thrive. And the only way you can do that is to prove that you can stay open and implement it every day. Operations is very hard because you can do that great for like 2 weeks and then kind of, lose track of it. Right. But you need to make sure your plan is in place and you're implementing every day. That's the only way we're going to be able to prove to the government and also be able to prove to the rest of the countries when we open up tourism again. Even this whole 5-day no testing, really honestly, it's challenging because we've had instances where people had to go back out to their country of origin and they get denied or they got the wrong test. And so we need to work out all of those issues and work with the government to make sure that everything we say we're doing, we're actually doing.
Okay, Mary. Thank you. Hey, let's make this a regular thing. Maybe we'll get you on next week, and who knows? We might be all running around on lockdown, so it'd be good to talk with you again.
I think it would be good to actually go through a couple of the checklists.
Yeah.
Okay.
And go by sector if you need to.
Yeah.
And really talk about even the crisis communications plan is
Right.
if in case you have somebody, possibly I overheard what you guys were saying about a specific company, whether they're in the tourism industry or in the food service industry, whether it's a wholesale distributor, restaurant, grocery store. Everybody needs to have a plan in place, including a crisis communications plan.
Right, and that's what we
so
saw.
I would love to share
that'd be
more on
great.
that with you.
That'd be
All
great,
right.
Mary.
Thanks,
Thank you, Mary.
Mary.
Appreciate it.
Okay.
Okay,
Thanks,
I'll see
everybody.
you. Read a book.
Stay safe and wash your hands,
Yeah,
Chris. Wash
stay
your
home.
hands.
I did 4 times this morning. Thank you, Mary.
Bye.
Bye.
There you go. Mary Rhodes, Guam Hotel Restaurant Association. 9:34. Let's keep it going in our KUAM News Zoom room and bring